So this is your breast massage instructions. You're going to do this 3 to 4 times a day for the next 3 to 4 months, or until you're happy with how they look and how they feel. The breast massage instructions, when you're doing this, it prevents contractures, softens the implant, and helps it drop into the pocket quicker, and it just gives you that natural, pretty shape and feel. So there's 4 directions to go in. Doesn't matter what direction you go in first, as long as you do all 4 directions. You can space this out throughout the day, or you can do it back to back, first thing in the morning. If going under the muscle, I always recommend doing it first thing in the morning when you're taking your shower, because you have, the water hitting the chest and it loosens those muscles for you and makes it easier to do. So you have up, down, out, and then in, okay? For up, you're holding pressure for 30 seconds. Down, you're holding pressure for 30 to 45 seconds. We focus more on that one because we want that implant to drop into the pocket quicker. And then for out, you only hold pressure for 10 to 15 seconds because nobody wants side boob, and natural curvature is okay. We just don't want you spilling out of your bra. And then this one, you're squeezing in and showing cleavage, basically. You're going to hold this position for 30 seconds. So each time that you're doing this in the 3 or 4 times a day, you're increasing the amount of pressure that you're applying. Basically, the whole concept of the massage is just to apply pressure all the way around the edges of the implant. You're not technically massaging like you would get at the spa.
It's more just a pressure point.
Yeah.
Pressure.
Mm-hmm.
Okay.
Mm-hmm. So, you're going to do 1, 2, 3 to this side. Squeeze in, and then 1, 2, 3 to the other side, and then squeeze in again. Let me put this over here, and we will do this. So you're going to do opposite hand to opposite breast. If you make an L shape like this with your hand, pointer fingers to the ground. This hand is going to come right over here to this breast, just like this, and then you're going to push and hold 10 to 15 seconds. You don't have to hold the pressure today. And then you're going to come directly under, like this, right at that incision line, and then push up, hold for 30 seconds, okay? And then with the base of your hand, you can use one hand, 2 hands, whatever makes you comfortable. You're going to come up to the top like this, up to the collarbone, smooth down till you feel the top of the implant. It feels like a bag, and then you're going to stop. So let's back up just right there. And then you can position with 2 hands too, like this, if that is more comfortable. Squeeze in, like you're showing cleavage.
Okay. That movement is a little bit uncomfortable.
Yeah. Okay. And then you're going to repeat the same thing on the other side. Okay. The more you do this, the better it feels, the easier it gets, but expect it to be tender and sore initially. Okay? All right.